Hello, I'm Dr. Jim Doty from Stanford University, the Center for Compassion and Altruism Research and Education. It's really a joy to be with you today as we celebrate World Health Day, a part of the Yoga for Unity program to build a better world, a more fair world. What I'd like to talk to you today about is compassion. The definition of compassion is the desire to alleviate the suffering of another. And this is really a fundamental part of our humanity, and in fact, what has allowed our species to survive over the last 200,000 years. And in fact, what many of you don't know is that our DNA has not changed in that time. What does that mean? Well, on the one hand, the reality is that our species, unlike other species, do not run away into the forest or swim away after our birth, but we are required to be cared for well over a decade, if not a decade and a half. As a result of that, it's absolutely critical that our caretakers, our parents, our mothers, care for us. But why would they expend so much energy, so much time, so many resources? And the reason is that when you care for another, you are rewarded. As a child, we have a system called the mirror neuron system, which means we model our behavior after our caregivers. And that's absolutely critical. That being said, we have to be cared for. So if we're hungry, if we're in pain, if we're uncomfortable, if we're unhappy, that needs to be addressed. And as a caregiver, when you respond to this distress, when you recognize someone's suffering, you feel this motivational desire to alleviate that suffering. And what's amazing is that when you do so, not only does it help the other, it helps yourself. And how does it do that? When you care for another, this actually stimulates a part of your nervous system called the autonomic nervous system. The autonomic nervous system has two parts: the sympathetic nervous system and the parasympathetic nervous system. In the modern world, for many people, the sympathetic nervous system is chronically engaged. And that's the part of our nervous system that is associated with the flight, fight, fear, or freeze response. It's what happens when we're anxious, when we're afraid, when we're stressed. And unfortunately, in modern society, especially in the face of the pandemic, this is even worse than it's ever been before. And it's really negatively affecting so many people. The other part of the nervous system is the parasympathetic nervous system, what is commonly called the rest or digest system. And this is the system that engages when you're not afraid, when you're relaxed, when you're comfortable, when you're not hungry, when you're safe. When this system is engaged, amazingly, your physiology works at its best. When the sympathetic nervous system is engaged, this is a survival strategy and it results in very limited possibilities in terms of decision making. We were just trying to survive. When you're in the parasympathetic nervous system, when that system is engaged, what happens is that you have access to this part of your brain called the executive control areas. And what this does is it gives you access to memories, experiences, and allows you to make much more thoughtful, discerning decisions about your actions. The other thing that happens is your physiology actually works at its best. Your blood pressure is lowered. Your cardiac function is improved. Your immune system is boosted. The production of inflammatory proteins is decreased. And of course, inflammatory proteins are associated with a variety of chronic diseases. Also, the production of stress hormones, such as cortisol, is actually significantly diminished. And in fact, what we do know through science is that when one practices compassion with intention, this actually is better for your health than exercise or being at your ideal body weight. And in fact, it increases the length of your telomeres, which is associated with an increase in longevity. The other thing that compassion is frequently associated with is connection or community. When you are with, if you will, your tribe, you feel protected, you feel loved, and as a result, you are connected. I'm sure many of you have heard of parts of the world that are called the blue zones, and these are typically places where people live to over 100. Now, of course, part of this is related to diet, but actually a great part is also related to connection. Because in these places, people typically are born there, they've lived there their entire lives, they live with multi-generational families, they've known their neighbors, their friends their entire lives. And the most important thing is that even with all their insecurities or their fears, they know, though, that they are loved, that they're accepted, that they're not judged. And unfortunately, in modern society, we don't live with our relatives, our brothers, our sisters, our parents. We don't live with people we've known our entire lives. And many of us are in highly stressful jobs. As a result of this, many of us are stressed and anxious. And I've already mentioned the negative consequences of that. So, how do we overcome that? How do we live a life where we recognize the suffering of others, we do our best to alleviate that suffering in the face of the modern world? Before I discuss that, though, let me mention something more about the autonomic nervous system. The vagus nerve begins in the brainstem and actually innervates or is spread throughout the entire body in various organs. The organ where it's most prominent is in the heart. And it's not a one-way connection between the brain and the heart, but it's a two-way connection where we're receiving information from the heart and making decisions about that, such as if you exercise, if you care about someone, how you respond. Conversely, the brain is sending signals to the heart as well. And this is a constant, ongoing conversation. And then that conversation determines whether your sympathetic nervous system is engaged or your parasympathetic nervous system is engaged. When I talk about compassion, though, another very important component is compassion for self. So many of us are very critical of ourselves. We tell ourselves stories that we're not good enough, we're not smart enough, that it's not possible. And the problem is when you tell yourself these stories, that becomes your reality. And the nature of telling yourself those stories is really baggage that we've continued with as part of our evolution. And remember, evolution doesn't happen overnight. It doesn't happen in 1,000 years or 10,000 years. And that's why I said earlier, over the last 200,000 years, our DNA has not changed since when we were on the savannah in Africa. So the mechanisms that allowed us to survive there are still with us. And one of those mechanisms is the reality that negative things which put us at risk stick to us for obvious reasons. Yet when we're relaxed and we're comfortable, those things don't stick with us as much because they don't threaten our lives. But what happens with that is that negative comments, negative events stick to us. And they help create this negative narrative that is so common in the West, especially, that is very hypercritical. Many people are more critical of themselves than anyone else. And the problem is, though, for you to care, for you to be compassionate with others, you have to deal with your own pain and suffering first. Some have said there cannot be peace in the world unless there is peace within our hearts. How do you achieve that? Well, when I was a child, I had this same negative narrative. But fortunately, I had a teacher who made me understand that that was a false narrative, that the comments that I was making were not necessarily real at all, but they were a collection of things that I thought people said about me, that perhaps something had occurred that made me feel that way. And as a result, I had this ongoing dialogue. But what this teacher taught me was a meditation practice, a breathing practice, sitting calmly, slowly inhaling through the nose and exhaling through the mouth. While in my own instance, it was while looking at a candle, but you can also use a mantra. But in the process of that, it started shifting me from engagement of my sympathetic nervous system to engagement of my parasympathetic nervous system. And then I realized that this was a false narrative I had been telling myself. And I was taught how to change that narrative from one of being critical to one of self love, believing that I was worthy of love. Through that process, one of the things I realized was that I was very afraid of being judged because I believed that when I was open, when I was authentic, that if people saw deep inside of me, that they wouldn't like me. And what's interesting about that is that I found, and it's been shown by science, when you can be your authentic self, when you can recognize you're not perfect, when you can share that reality, when you can ask for help, in almost every instance, people will reach out to you and care for you. Unfortunately, in modern society, though, people are afraid to do so. And what happens is I will make a projection of what I want people to see. I'm a professor, I'm a doctor, et cetera, to increase the appearance that I'm important and that I'm not vulnerable. And of course, when you interact with someone and you do that, then they will do the same thing. And as a result, you can never truly connect. In fact, a study was done at Harvard in men over the age of 75, or excuse me, in men, and this study has been going on for over 75 years. And the results are that people lived the longest when they had human connection and people they could share with who they really are. And that is what I'm hoping you understand, that is a very deep truth about yourself and about our world. And this is how you build a fair and healthier world. When you accept yourself, when you love yourself, when you feel you are worthy, it changes how you see the world. Because you recognize on some level, everyone is suffering. When you're able to look at the other and you see yourself, you cannot not care. And we know that when you reach out, when you care for another, you shift from engagement of your sympathetic nervous system to your parasympathetic nervous system. And that is when you're healthiest. The Dalai Lama has said, being compassionate is the only time it's okay to be selfish. What did he mean by that? He meant that because of all the positive benefit you receive from caring, in some ways that is selfish, but you are being of service to others, and then in that instance, it's okay to be selfish. So, especially for younger people with social media, especially, many people feel judged. Sadly, a large number of people in their teens decide they want to be social influencers. And the problem is, for so many, this is a hollow existence. Taking pictures of yourself, trying to appear that you're perfect. Unfortunately, all that is a recipe, because none of us are perfect. Every one of us has had failures. Every one of us has done things that we're ashamed of. And when a person who is more interested in what people think of them, they're often terrified of being judged and being rejected. And that leads to, to an unhealthy life, not only in terms of your mental health, but also in terms of your physical health. So, how do you live a life of meaning and purpose? And this is somewhat different than the traditional perspectives of what makes one happy. Many people are confused that happiness relates to what you have. That if you just get X, if you just get Y, you're going to be happy. But unfortunately, the origins of happiness are not external, they're internal. Happiness is a manifestation of accepting who you are, of being vulnerable, and that gives deep, deep happiness. And one of the other aspects is that when you look out from yourself and not ruminate on your own situation and be hypercritical, but focus outward, when you care for people, when you love people, when you accept others' weaknesses or foibles, that is when you get true, true happiness. During the time of the pandemic, many people have had their own mental health issues aggravated. One of the things that results in that is a desire for a past that no longer exists, an attachment to that past. Attachment is a cause of suffering. If you accept the reality that the situation has changed, and then by doing so, that allows you to not focus on the past, but deal with the present and manifesting solutions to how best function in the present reality. In summary, I'm going to leave you with something I call the alphabet of the heart. And this is a practice that I engage in every morning. I sit by my bed. I take several slow, deep breaths and exhale. Think of joy and awe about being alive in this extraordinary world. I think about my blessings. And then I go through 10 letters of the alphabet, C through L. C, compassion for self and others. D, recognizing the dignity of every person. E, practicing equanimity, evenness of temperament, not to get lost in things that are wonderful because they're transitory, nor in things that cause you pain, which typically are also transitory. Having this evenness of temperament. F, forgiveness. Being angry at somebody because you feel you have been wronged. That anger is like drinking poison, somehow thinking it's going to affect the other person, and all it hurts is you. That's not to forget, it's simply to forgive, go on with your life, not be attached. G is having gratitude. No matter your position in the world, there are a huge, huge number of people who are much, much worse off than you. As a neurosurgeon, I have situations where people have become, as an example, paralyzed from the waist down from an accident, and they're very deeply suffering, and they feel life's not worth living sometimes. But then I'll introduce them to someone who's paralyzed from the neck down, cannot move their arms, cannot move their legs, and are on a ventilator. And some of these people are the most joyous, happy people in the world. So, regardless of your situation, it can always be worse. Humility, not believing that you're any more important than anyone else. In my job, I know the people who clean the floors, who change the bedpans, because I can't do my job without them. So I recognize how critical other people are in my own life that make it easier, that allow me to do what I do. I is having integrity and values that bound your behavior. J is a sense of justice or fairness in terms of your interaction with others and your responsibility for caring for those who are more vulnerable. K, kindness. You don't have to be suffering to be kind. Yet the kindness you display to others, sometimes even a smile, can change a life. And of course, all of this is contained by that most important value, and that is love. So, in summary, love yourself, love others, and recognize that every one of us has within us the ability to improve someone's life every day. Thank you for allowing me to be with you. I wish all of you the best. Much love to you. Take care.
Hello, everyone. My name is Dr. Kamal Raj. Many thanks for inviting me as a speaker on this World Health Day 2021. My topic, which has been given to me, is building a fairer, a healthier world. Today is WHO's birthday. It was on the 7th April 1948 that WHO came into being. It's a day we mark every year as World Health Day. In recent years, countries in the Western Pacific have experienced rapid economic growth. This created opportunities for better lives for many, but many left behind. COVID-19 pandemic has undercut recent health gains also, pushed more people into poverty and food insecurity, and amplified gender, social, and health inequalities. That's why the theme for this year's World Health Day is building fairer, healthier world for everyone. 2020 has reminded us that health is the most precious commodity on earth. Throughout 2021, WHO will focus on engaging policymakers and bringing people together to build a fairer, healthier world. World must invest in strong health systems that protect everyone now and into the future. In order to build a fair and a healthier world, WHO is launching two initiatives to support and rapidly accelerate countries to build fairer and healthier world. The first one is a global program to strengthen primary health care, better equipping countries to prevent and respond to emergencies of all kinds, from the personal crisis of a heart attack to an outbreak of a new and deadly virus. The second one is a new universal health coverage designed to help countries develop the packages of services they need to meet the people's health needs. You know what? Our world is an unequal one, sadly. As COVID-19 has highlighted, some people are able to live healthier lives and have better access to health services compared to others. This is entirely due to the conditions in which they are born, grow, live, work, and age. All over the world, most of the population struggle to make ends meet with the daily, very little daily income. This leads to unnecessary suffering, avoidable illnesses, and premature deaths. And it harms our society and economies. This is not only unfair, it is preventable. That's why we are calling on leaders to ensure that everyone has living conditions and working conditions that are conducive to good health. At the same time, we urge leaders to monitor health inequalities and to ensure that all people are able to access quality health care services. From my experience working in over 30 countries globally, I've had an opportunity to work in conflict, emergency affected countries. I have witnessed, I've seen myself, malnourished mothers waiting for the food to be dropped. You know, there is an UN organization called World Food Program. So these malnourished mothers are waiting for the food to be dropped, pounding sorghum. Sorghum is a grain, food grain eaten in some parts of the country. So these women start pounding sorghum under the sun with 50 degrees sometimes to feed their hungry children. And these hungry children are waiting for a mother to cook the meal with that sorghum flour. I'm just giving an example. I'm just telling you this particular uh, thing that I have witnessed in a couple of countries. See, what a disparity. Where are our institutional donors from the wealthy nations? I witnessed children dying due to complicated malaria, cholera, malnourished children, severely acute malnourished children. Nothing much has changed over these last 10 years, at least that I know myself from my travel. I worked in refugee and population displacement camps in conflict affected countries where access to basic healthcare is a problem situations. Children sustain severe injuries and elderly die due to lack of medicines for chronic illnesses. So we need honest and committed organizations to put an end to these atrocities. We need donors with big hearts and dedicated and honest leaders to serve their communities with love and empathy. So peace and political stability of a nation impacts the development and prosperity of that particular nation and thereby contributes to a healthier world. So it is so important to work hand in hand with affected communities and individuals to address inequalities and implement solutions. The impact will be greater when governments and communities work together. When they work together in a very coordinated approach. So I appeal to all governments to focus on improving the planning, the budgeting, the financing, financial management capacity, and strengthen governance and accountability. Uh, it is also very important that all governments ensure that the health data is very important. Health data is being collected, is reliable. The data is reliable, the data is timely and disaggregated by gender, age, income, education, and so on. Only then it is possible to assess the inequalities across population and actions can be taken that have the impact. So data is very important. So to build a fairer and a healthier world, we need to adopt a whole of government approach, meaning entire government is involved to address the root causes of inequalities and increase investment in primary healthcare system. It is also important that wealthy nations extend their assistance beyond their national borders. India is setting an example with its giving heart to over 25 countries so far with vaccine supplies. When India becomes self-sufficient with these resources, I personally feel that it can never go back in extending support to build a fairer and a healthier world when we are self-sufficient. Recently, WHO released a report which shows that 80% of the world's nurses, health providers, work in countries making up just half of the world's population, 80%. So, although the number of nurses globally increased by close to 5 million between the years 2013 and 2018, the world is still facing a global shortfall of around 6 million health providers, so nurses or midwives. So one of the lessons I hope the world learned from COVID-19 is that we must invest in public health. For a huge country like ours, India, with 1/6 of the world population living in this country, our public health system is way behind, unfortunately. But at the same time, I'm glad Indian government acknowledged the importance of public health and doubled its union budget for this year for public health spending, which is very good. Universal health coverage is WHO's #1 goal. It is meant to achieve that everyone can obtain the care they need when they need it, right in the heart of the community, universal health coverage. Millions of people still have no access at all to healthcare. Millions. Millions more are forced to choose between healthcare and other daily expenses such as food, clothing, and even a home. More than 1 billion people, from recent articles that I have studied, I have read, living in informal settlements or slums, are facing increased challenges in preventing infection and transmission of the coronavirus. 1 billion people. So, building a fairer and a healthier world requires a strategic plan. A plan, it is a process that ensures that everyone is on the same page about the vision. It is a plan that details where we want to be in the next 5 years' time, how we are going to get there, and how we are going to measure success. So there's a need for a strategic plan. So all governments should work towards having universal health coverage for its citizens. All countries can take rapidly towards universal health coverage. When people have to pay most of the cost for health services out of their own pockets, the poor are often unstable to obtain many of the services they need. So it is crucial to have robust financial structures in place. It's very important. Investments in quality primary health care will be the cornerstone of achieving fairer and a healthier world. Very important. Countries need to rapidly scale up their investments in essential public health services. Like this, I'm an epidemiologist, I'm a medical doctor. It's so important for any country to have to remain in a constant state of preparedness. So the prevention, the preparedness, the readiness, the response, and the recovery. So we have a skilled workforce in place to be able to have these functions, public health functions in place. Then we will be able to handle, address even any new pathogens coming as a pandemic or as an epidemic in a country. So now, health is not a luxury. Health is a human right. It's time for health for all. We know universal healthcare is possible. It is in the hands of governments to prioritize health and ensure universal health coverage for citizens. Universal health coverage means that all citizens have access to the quality health services they need when and where they need them without financial hardship. So, unsafe and low quality healthcare ruins lives, and it costs the world trillions of dollars every year. Governments must do more to improve the quality and safety of health services globally. Primary health care can cover 80 to 90% of people's health needs across their lifetime. Strengthening primary health care systems in low income countries through funds coming from external resources becomes very, very important to save lives. So building fairer and healthier world means not just spending more on health, just spending better, from protecting health workers and strengthening infrastructure to preventing diseases and providing healthcare close to home within the community. Investments in health systems also improve countries' preparedness and response to future health emergencies, like the one now we have this COVID-19 now, a pandemic. Finally, I call upon leaders around the globe to address inequalities in their own countries to build a fairer and a healthier world. Health is the most precious commodity on earth. COVID-19 pandemic has shown us that no one is safe until everyone is safe. Thank you very much.